My name is Chaely. I'm a thoracic oncology nurse practitioner. I practice at the Novant Health Cancer Institute in Winston-Salem, North Carolina. I'm here at JADPRO Live, and the presentation that we presented was Imaging Modalities on Oncology Urgent Care. And the purpose of the presentation was to help APs get oriented with what the normal findings should be on CT imaging, MRI imaging, so that when they're reviewing scans for patients, they can identify what's abnormal, and they can be able to better communicate that to their patients. They can better diagnose that, better treat that, and ultimately have better patient outcomes. And so that's really important in what we do. We like to practice at the top of our license, and being able to look at an image and say, yes, this is what I'm seeing, like I'm agreeing with what the radiologist is saying, I see this myself, I understand what this is, and I can then turn around and explain it to a patient, is really valuable in being able to accurately and appropriately treat the patient, but also gaining their trust and doing the best that we can at the top of our license. My training was primarily done at an academic institution, and my supervising physician that trained me took a great interest in teaching me how to read these scans and showing me, like, as we were caring for patients, what exactly we were seeing and how that applied to what was going on with the patient and how we were helping them. And so the way that I learned was by being taught firsthand, but when that wasn't available to me, it was just looking at the scans. You know, I would get the scan report and then I would pull up the image, and every time I would scroll through from top to bottom and make sure that even if they were not specific oncology findings, that I was identifying the things the radiologist was calling. I was identifying lymph nodes, even if, you know, they weren't necessarily enlarged or if they weren't concerning. I still wanted to make sure that I could see them on the scan myself. And over time, I kind of was able to be more familiar with it, and then just be able to scroll up and down and quickly point these things out to myself without having to spend as much time. But it did, you know, take time, and it took practice, and it's something that I still practice now to make sure I'm not missing anything, and just make sure that everybody's on the same page. Me, the radiologist, the attending doctor, and then of course the patient as well. Well, the presentation is really fun. I was able to do it with one of my colleagues and good friends, and we were able to work together closely. And so, you know, my part of it was kind of the chest piece, and her part was the GI piece, you know, so we also covered abdomen, pelvis, and hopefully we're reaching a large group of APs that are seeing chest, abdomen, pelvis CTs, not just for lung cancers or GI malignancies, but for, you know, cancers across the board. Just, it doesn't have to be the primary site, but also just metastatic disease. So I think it's really great. It's informative. The workshops are super informative and kind of kick off everything for JADPRO. But the conference itself is just amazing. It's a great time to network with people that you might work with, but maybe don't get time to kind of talk through anything professionally or even personally to get to know them better. And it's a great time to meet people from all across the country to learn about their practice and how it's the same as yours, how it's different, how can you be better, and just learn and grow the whole time. It's fun. Unfortunately, I am seeing patients after, you know, they've been screened and they've found these potential malignancies, these nodules that then we kind of like follow and work up. But it is so important that patients are getting the low dose CT screening so that we can identify these nodules early, we can find them, and there's so much new information about lung cancer treatment in the neoadjuvant and perioperative space, where we're able to, you know, give these patients medications, resect their cancers, and then they have an excellent, you know, long-term life after that. So I think what's important is having a nodule clinic or something like that, somebody who is able to follow these screenings, or some kind of multidisciplinary group that kind of can identify these patients, follow them closely, and then when we do find something that's concerning, get them to where they need to be, whether it's, the surgeon, the medical oncology team, whoever it is. But it really takes a lot of professionals, to kind of make that happen and get the best outcomes that we can.